Hello, and thank you for joining our webinar on gauging employee well-being and morale. Forget ROI versus VOI. Today's employers need to measure both. I'm Reagan Corliss, and I manage marketing for Journey, MedSavvy, and HPW, which does human performance and well-being programs. Together, our complementary services provide simplified healthcare delivery to your employees with comprehensive healthcare support, including virtual care and concierge services, well-being programs, and a unique medication management service. All work together to optimize employee health while saving on health plan costs. We're all tied together by Cambia Health Solutions, which is a total health solutions company that is deeply rooted in a 100-year legacy of transforming the industry and the way people experience healthcare. We're committed to delivering a seamless, personalized healthcare experience for the next 100 years. So real quick housekeeping items. Your feedback is very important to us. Plus, we'd love to hear if you have any other ideas for future webinars. A form will pop up at the end of this webinar, and you can ask us any questions then and provide us with the feedback. Also, you need to be sure to watch the entire webinar in order to receive the SHRM or HRCI credits. So we're very excited about our speaker of rosters. First, we have Colleen Carey. She is VP of Sales and Marketing for Journey. And then we have Jeff Fitzpatrick. He is Head of Product for Human Performance and Wellbeing. And then also Megan Boyd. She runs the Client Success Program for Human Performance and Wellbeing. And then we have Cassie Buckroyd. She is the Wellbeing Programs Manager at Columbia Sportswear Company. And also Amy Wallach. She is a Wellness Programs Manager for Cambia Health Solutions. So starting with Colleen, again, she's the Vice President of Sales and Marketing with Journey. And Journey is a revolutionary digital health benefit platform. Journey helps employees take full advantage of their healthcare benefits in an all-in-one platform, delivering support when, where, and how they need it most. It's a healthier way of doing business for employers in need of flexible and convenient health solutions. So Colleen, I'm going to hand it over to you now.
Hi, I am Colleen Carey, and I am head of the Journey Sales and Marketing team. We're so glad you could join us today. We have a really interesting topic today, talking about wellness programs and how to measure and evaluate the success of those programs. As you can imagine, during the, we are now 9 months in to this global COVID-19 pandemic. And so never has employee wellness and well-being been more important than it is right now. What we are observing through our clients and across the healthcare industry is increases in chronic conditions related to stress, anxiety, depression. The social isolation and self-isolation has led to reductions in exercise, fitness, nutrition. And so there's really no better time than now to be thinking about a wellness program if you don't have one. And if you do have one, to really be thinking about how do you measure it. It's always been a challenge to come up with a straightforward sort of ROI, return on investment metric around wellness programs, because they affect so much more than just the dollar investment. They affect employee productivity. They affect employee absenteeism, presenteeism. Today, we're really excited. We're going to be providing you a look at two very different companies, Columbia Sportswear and Cambia, which is a regional parent company for a health plan out here in the Pacific Northwest. And we're going to see the kinds of best practices in how they're approaching the programs themselves and the metrics and way in which they're measuring from two very different perspectives. So I'd like to start out by introducing Jeff Fitzpatrick, who is our head of product for our human performance and well-being solutions here at Journey. Jeff has a background in exercise science and digital product development and has served in the health and well-being industry for over 13 years. Jeff, take it away.
Thank you, Colleen. I appreciate that warm introduction. Well, thank you all for having me here. I'm very excited to talk about the symbiotic relationship between ROI and value. I think we have a lot to cover. I'm going to jump right in. So the first thing we want to do is talk about the two definitions of ROI and VOI and how they differ. So ROI has typically meant that employers have looked to justify their investment in wellness programs by driving healthcare costs down. And when we think of VOI, VOI measures the impact that wellness programs have on employees through things like productivity, morale, improved presenteeism, and even a reduction in absenteeism. So we've been here before. We've talked about this before. So why is this conversation important now? Well, the reality is the market is shifting. And as we used to look primarily at ROI, employers are starting to look more at VOI, the value on investment. And also, we cannot ignore the facts that the impacts of COVID-19 are real. And they're real in cases like stress. So the increases in stress related chronic conditions are significantly impacting the workplace. So this conversation is extremely relevant right now. So I'm really happy that we have some time to go through it. So as we talk about ROI and VOI, let's talk about some basic definitions. So the definition of ROI first. So ROI is related to wellness programs, typically includes overall healthcare cost savings achieved. The actual return on investment is the decrease and prevention of costly claims. That's typically the way that it's been looked at in the past. And so the rationale for these programs, the rationale for well-being solutions has been things like saving on these healthcare costs. Oftentimes these wellness solutions are a part of an employee benefit package, or furthermore, they could be a part of another package, another product package. So when defining VOI, we think about things like morale and productivity. So VOI encompasses the invaluable benefits of employee health. Values like morale, the decrease in the use of sick days, productivity, positivity, and talent retention. These are the areas that we think about when we think and we talk about VOI. So VOI can be elusive, and people ask, well, how do we measure it? And we'll get to more of it later, but some approaches right now to think about and how to measure VOI are taking a look at your sick days, increased employee productivity, and how you measure productivity varies per your organization, certainly. Increases in morale, improved morale, and then recruitment and retention values. Are you retaining that workforce that you want? I know that within my organization, we think and talk about that quite a bit, retaining that top talent. So let's dig a little bit deeper on the ROI side of things from a more traditional perspective. So the reality is wellness solutions are under a lot of pressure. They're under a lot of pressure to do what? Basically reduce healthcare costs. And we know this because chronic conditions are a big deal in this country. For example, and we do pick on diabetes a little bit sometimes, but the annual cost of a person with diabetes is about $13,000. So chronic conditions play a big part. In fact, the top 10 chronic conditions that are driving the costs are the ones that are here in the middle of your screen. And I wanted to throw out a little bit of information, a little bit of data for you. So a couple numbers to keep in mind when we're talking about chronic conditions and why wellness solutions are here to help drive those costs down. One thing to think about is that 75% of the nation's aggregate healthcare spending, or an estimated $5,300 per person, is spent in this nation each year. So the costs of chronic conditions are real. And so that's one of the traditional reasons that well-being programs exist and why folks are looking at the ROI of them. So can you produce an ROI? Can you extrapolate that from your wellness solution? We get asked this often, and my answer is, well, it kind of depends on your perspective. So as we look around, there's no shortage of studies, but the two studies that I really like are a little bit older, and they're older because one of the reasons is because they do require time. They require quite a bit of time to measure the ROI. So if you look at a study from 2012, U.S. employers have cited a $1 to $3 decrease in their overall healthcare cost savings for every dollar spent. So there is a savings there. So they know if we can invest in our employees, we'll see that cost savings return to us. So another thing that I want to reinforce here is that investing in your well-being is investing in your business. There was a study done, I think it was a 2018 Gallup study that showed that, and it was a survey of about 30,000 adult workers in the United States, and they rolled out a well-being solution. They took a look at the ROI from a VOI perspective. And areas such as retention, absenteeism, productivity, even sales and profits were looked at. And as you can see by the numbers on the screen here, that if you do deploy a proper well-being solution and you take a look at it from a VOI perspective, it truly can impact your bottom line. And just remember that investing in well-being is truly investing in your business. So we've talked a bit about ROI, but I want to leave you with some conclusions. So ROI is out there, it exists, but it can be difficult to measure. And when you're measuring it, keep in mind it takes time. ROI from well-being does take time to measure. You may have to invest in that and inform your executives that it's going to take us time to measure that. And ROI is still important. We're not here to talk you out of it. ROI from a well-being perspective is extremely important, especially when you talk about condition management. And finally, the conversation's evolving. It's not just ROI anymore. There's more to the conversation indeed, and that is a very good segue into the next part of what I'd like to cover, which is VOI. So I mentioned VOI before, and I want to do a quick refresher of the definition. So remember that VOI encompasses other things like the invaluable benefits of employee health, things like morale, decrease in the number of sick days, absenteeism, increased productivity, positivity in the workforce, and even your talent retention. So when we think of VOI, we think of more of these intangible, invaluable benefits. So why is it important? I think you're starting to get the picture, hopefully, but hopefully you're starting to also understand that there's some key words that you want to think about. For example, how is morale positively or negatively affecting your workforce? Is mental resilience important to your team? Do sick days really impact your productivity? These are questions that you need to ask yourself. But perhaps the best question that you want to ask is, are your employees bringing their best selves to work every day? Are they showing up as their most productive self? Have they bought into that culture? This is the question that you really want to ask yourself. So when you ask yourself about VOI and you've kind of come to terms within your organization about what's important and what's working for you, the next step that you have to cover is, well, geez, how do we measure VOI? Well, I would challenge that a better question is, what should you be measuring? Because the cost of an unhappy, unhealthy employee who lacks motivation can negatively impact your bottom line. And I want to share some costs with you, some numbers with you. So let's talk about retention. When we think about retention and turnover. So the average total cost for turnover in the United States is about $15,000 per employee. So you can imagine, if you can just retain the top talent, the talent that you need, you can truly cut down on those costs. What about absenteeism and presenteeism? So we know that there was an '09 study done by Ronald Lopke and colleagues of absenteeism and presenteeism among 50,000 workers at 10 different employers. And that study showed that lost productivity costs were 2 to 3 times higher than medical and pharmacy costs. So absenteeism and presenteeism does indeed hit the bottom line. What about mental well-being? So when I think of mental well-being, I think of stress and how folks are handling that and how mentally resilient they are. So in another study, in a year, lost work days due to stress cost about $30 billion across the United States workforce. And morale is a big deal. We don't want to ignore that either. So when employees feel dissatisfied and they're not invested in the work they produce, or they're discontented with managers, the level of absenteeism increases, leading to less productivity. Unscheduled employee absenteeism costs an average of 9% of payroll. So these are all direct costs to your bottom line. So this is what you should think about when you think about VOI. This is why it's important. So let's get down to it. Let's say, okay, great, I'm in. What's the approach here? What's the tactical approach? So step one is for you as an organization to determine what matters most to you. Look at your goals and customize the program to drive the right engagement. You should be working with your client success management team, and they should be able to customize your well-being solution to drive towards the metrics that matter most to you. So determining what matters most is extremely important. Areas like morale, presenteeism, mental resilience, we covered these areas. Really think about that. Meet with your leaders, and you will quickly come to terms with the areas that you want to focus on within your organization. And so once you've determined what matters most, you need to measure what matters most. You need to look at self-reported as well as utilization metrics, and that'll give you a complete picture. So when we think of self-reported metrics, we think of things like engagement surveys, onboarding and exit interviews. You better believe you'll get some pretty good information in some of those meetings, as well as cultural buy-in surveys. And then when you think about utilization, think about the services that you offer today. Are they being used? What types of services are being used? Where do you need to put more energy, more investment? And then ultimately take a look at your customer service statistics. So that's it for me. I appreciate your time. I was excited to go through this. Hopefully you've taken some nuggets here and you can take them into your organization and put them into play. And so now what I would like to do is I would like to introduce one of my colleagues, Megan Boyd. Megan's going to talk about VOI in action. So Megan is a client success manager with Cambia's Health Solutions Human Performance and Wellbeing Division. In this role, she partners with employers and brokers in the strategic development, implementation, and ongoing evaluation of health and well-being programs. Megan has spent the last 10 years in the corporate well-being industry servicing clients of varying sizes, demographics, cultures, and industries. She has a BA in psychology and a master's in organizational psychology. Take it away, Megan.
All right, thank you. We're very excited to have two great employers with us today to share their VOI in action stories. Our first guest is Cassie Buckroyd. Cassie is the Wellbeing Programs Manager for Columbia Sportswear Company. Cassie's career spans 20 years in this health and well-being space. For the last 15 years, Cassie has worked with employers in varying industries, from small businesses to Fortune 100 companies, focusing on topics such as wellness program strategy, implementation, as well as evaluation of programming. Cassie has now led the Columbia Sportswear Company in well-being for the last 6 years. She's grown this program from inception all the way into now what is a global initiative and cornerstone of their Total Rewards program. Cassie graduated with a Master's of Public Health from Portland State University and a Bachelor's in Psychology from Oregon State University. As a true Oregonian, in her free time, you can find Cassie mostly outdoors, hiking, running, as well as backpacking around the Pacific Northwest. So let's dive in and get to know Cassie and Columbia Sportswear Company a little better. So welcome, Cassie. We're happy to have you here today.
Thank you for inviting me.
All right, so let's dive into some questions and get to know Columbia Sportswear Company a bit better. So can you tell us a little bit about the mission of your organization, connecting active people with their passions, and how well-being ties into this mission?
Sure. So our outward and inward facing mission is, as you said, we connect active people with their passions. And this was a mission statement that was developed about a year into my time at Columbia Sportswear. So as you can imagine, being the well-being manager and hearing this mission, I did a little happy dance in my seat when they announced it, because it clearly ties to well-being. Along with our mission, we have a whole strategic roadmap that goes along with that. And so it's been very intuitive and easy to tie our well-being initiatives to our mission and our strategic roadmap.
Can you now take a few minutes to tell us a little bit about your well-being program strategy for Columbia Sportswear?
Sure. So our well-being program isn't necessarily hinged on a premium reduction program, although that is a small part of our program. It's really much bigger than that. It's really geared towards creating a culture around well-being and using it to attract and retain top talent. We are in a very competitive talent market here in Portland, with Nike and Adidas being here as well. And so really we have taken well-being and used that to be our differentiator as an employer of choice. Several years ago, as I was evolving the strategy, I created a model around well-being and what that looks like for us. And it's based on Rath and Harder's well-being model from Gallup. So we focus on 5 pillars of well-being: physical, social, community, career, and financial. Almost forgot the 5th one. We kind of categorize all of our programs and make sure that we have programs that touch all of those 5 pillars. And as a result of creating that model and kind of getting leadership buy-in on it, we've adopted that as our total rewards philosophy, where again, it's something, it's kind of what the cornerstone of how we attract and retain top talent, and what we use to create, great employee experiences. And it's a big strategic initiative.
Thank you for sharing, Cassie. And what a great story. You set out to, establish your well-being mission and ended up helping reestablish your total rewards philosophy for the whole company. So that's just awesome. And a lot of what you're mentioning here around talent retention, acquisition and retention ties in nicely with some of those VOI measures that we heard from Jeff earlier on in our presentation. So thank you for sharing. So my third question for you, Cassie, is can you tell us a little bit about the true value for your program? What has your program delivered to your employees?
So by having well-being as our total rewards philosophy, it's really allowed us to focus on our model and using that to attract and retain and differentiate ourselves as an employer of choice. And for our employees, it means that we're looking at them in a holistic manner. The other thing that I love about our model is that, things like financial well-being and community well-being are not just pieces that come out of my team, the benefits team. There are pieces that come out of our community relations team, our learning and development team, our compensation teams. And so really it is a cross-functional initiative. Even if it is owned by my team, it's cross-functional, which allows us to further embed well-being into the fabric of who we are as an organization and make sure that it's central to our culture. I would say in terms of the value that it brings to us and to the organization and employees is that it allows us to attract and retain. That's really what it's always been about at Columbia, is attracting and retaining top talent. I think we do look at, our healthcare dollars and our spend, and we look at outcomes of our medical claims and things like that. And that does drive a little bit of how we make decisions around investments that we're making in the program, but it doesn't drive, the well-being program itself. And so I think, while it's been a while since we've done an employee survey, I do hear from employees and the business a lot about how the programs and things that we have in place have really impacted them on a personal level. And then, even from an attraction level and attracting talent, I hear from our talent teams that people cite well-being as one of the reasons that they came to the company in the first place.
That's great. Thank you so much for sharing that, Cassie. And it really does sound like with your 5 pillars that you have been able to establish well-being really at every turn within the company, whether it's learning and development, compensation, as well as human resources. So I'm sure that creates a pretty unique feel as well as a culture to your organization. All right, so moving on to question 4. How big a factor has data been on shaping your program strategy?
So to be quite honest, gathering data and having access to data has been a challenge of the program. It's something that we are definitely looking to improve on. We've implemented a new HRIS system that improves our access to employee data and how we're able to look at employees. But we do use data from our medical plans to make program investments and to kind of understand what health issues exist within our population. We have that information segmented by location and job type, and so we can drill down into employee segments and deliver more targeted programming to them. And then we're just kind of getting started on how, making sure that we can report on outcomes of those interventions and really partnering with our health plans to do that.
All right, thank you for sharing. And accessing data can sometimes be a challenge, and leveraging data is something that we've seen as a progression for employers. Really taking a look at claims data, survey data is really great to be able to better understand what the health risks are for the population, as well as the opportunities for different interventions that you might be able to instill within your population. And it's great too to hear, Cassie, that you're focusing on starting to look at outcomes. And that's something that takes time. You know, outcomes do take time to be able to show. And so it sounds like the progression that you're describing makes a lot of sense. And establishing that expectation of tracking outcomes with your vendor partners is also really important too. All right, so switching gears a little bit. 2020, COVID pandemic. I imagine, Cassie, that this year has likely, as it did for many of us, create challenges to overcome with programming. Can you tell us a little bit about how you and your organization have managed through the challenges of 2020?
Sure. So prior to COVID, a lot of our program efforts were focused on our headquarters in Portland. So a lot of in-person, we have a very in-person culture, a lot of in-person programming, lunch and learns, events, and things like that, fitness classes, which is really nice because we have a great connected group of employees. However, we also have retail employees all over the US and our distribution center employees, as well as a global workforce. And so one of the silver linings I like to say of COVID is that it really forced us to think about the scalability of our programs and how we could turn our in-person events into something virtual, so that people who were now working from home could continue to take advantage of all of the great resources. And the great thing about that is now we are able to offer programs, or these programs to retail, DC. We've expanded our communications, things that we used to just really communicate with our headquarters about. We've thought about, how we can scale it out to the rest of our employee population. And so that's always been a challenge for me and something that I've really wanted to do. And so I'm kind of excited about that. And it continues to be, the importance of well-being has been highlighted by COVID. And so it continues to be a conversation in how we can continue to expand and grow our well-being programs globally.
All right. Thank you, Cassie, for that very thoughtful response on the challenges for 2020. And your story is not dissimilar from many other employers that I've spoken to this year. And we really have been thrust into really needing to face the cold hard reality of our program scalable, with many employees having to move to remote work. That has created a challenge. And so looking for those silver linings of really being able to learn and learn quickly is a great approach for not only you guys, it sounds like, but other employers as well. So thank you for sharing that. How do you see your program evolving over the next couple of years and your measurement of success as well? So in different terms, what's next? What's next for Columbia Sportswear Wellbeing?
Yeah, I think a couple of things come to mind. I think along with that theme of making things more scalable and accessible to employees all across the globe is investing in digital capabilities. That's something that I've been working a lot, even before COVID hit with my team and kind of building a business case. And so by investing, I think, another great thing about investing in digital capabilities is that it enhances our ability to measure the impact. So usually, these digital platforms, whether they be communication platforms or well-being platforms, have analytics built into them. So I think that's something that I see growing. So the scalability, going global, being better about measuring our outcomes, and things of that nature. And we really are focused on taking these 5 pillars that we've developed for our total rewards philosophy. We've already launched it globally, but really kind of making it a bigger thing for our global partners and helping them drive their well-being initiatives at a local level.
Thank you so much for sharing that with us, Cassie. And it certainly sounds like you have your work cut out for you over the next couple of years with focusing on that global initiative and really, starting to adopt some of those the technology partners to be able to help your program scale. And so very excited to see how that goes over the next couple of years. Well, we have learned a lot of great things about Columbia Sportswear and how you have been able to build a program to address well-being within your organization. And my last question for you, Cassie, is really around if you looking at our audience, we've got HR, financial professionals on the line. And is there a piece of advice, one piece of advice that you would like to share with our audience that you've learned over the years that they can take back and think about with their own well-being strategies?
I think the biggest piece of advice I have, the most important, is to focus on partnerships and who your collaborators might be. So that's one thing. Oftentimes, people who are internally running a well-being program are in charge of wellness. They're the only person who, or it might be a part of, they might be a benefits manager who also has wellness. And so it's really something that you can't go out alone, and you need to find those people within your organization that have a vested interest in well-being. So at Columbia, I've partnered with facilities, learning and development, or community relations teams, and we've been able to kind of expand and deepen our impact by partnering with one another. The other piece of advice I would have is to really learn about what's important to your leadership and approach them with a strategy and in a way that is important to them. So, if I'm approaching my CEO of whatever company I'm working for, or whoever my client might be, I'm going to know what speaks to that CEO. And oftentimes, well-being, people who go into well-being, they want to make the world better and they want to help people and improve lives, which is great. That's why I'm in the field. And it's not that CEOs don't care about that, but CEOs are bottom line driven. They want to know, what the competitive advantage is, and so it's really a business case approach when you're selling to a CEO or leadership. And so I guess I would say just know what's important to the person that you're talking to, and that involves kind of listening, right, or learning before you come with your own agenda. Yeah, I think those are the two big things.
Thank you so much for that. Those two great pieces of advice, Cassie. And if there's one thing we know, organizations are just so very different, and we all need our own unique well-being strategies, as well as how do we measure the success of our program. And so thank you so much for sharing your time with us today. And for our audience, we're really excited to continue our stories of VOI in action with our next guest, who is Amy Wallach from Cambia Health Solutions. Amy brings with her 30 years of industry experience. Currently, in her current role as Wellness and Safety Manager at Cambia Health Solutions, she successfully wins an award-winning holistic well-being and safety team for the nearly 5,000 Cambia employees. Amy and her team strive to empower personal accountability, enhance productivity, and encourage lifelong healthful habits along the way. Amy has her bachelor's degree in sports management and exercise from Washington State University. And in her spare time, Amy loves road trips, college football, and beer and wine tasting. This is going to be a fun guest for us. Welcome, Amy. We're happy to have you here today.
Thanks, Megan.
All right, so let's dive right in and get to know Cambia a little bit better. So can you tell us a little bit about Cambia Health Solutions' core values and how well-being plays into those values?
Sure. At Cambia, one of our core values is innovation. So naturally, we try new things. We really want to meet people where they are in their journey because, everybody's wellness journey is going to be different. So we try to intrinsically motivate people and not take that cookie cutter approach to well-being, because one size fits all approach isn't really inclusive, and we want to be innovative, and in order to be successful, that's what you need. So I would say another core value of Cambia's is empathy. We care for one another as employees, and then we care for the members that we serve. Our whole organization is aligned to focus on consumer and empathy is a critical factor in how we do our business. So healthcare delivery is personal, and empathy naturally aligns with all of our well-being efforts. Last value that I'll mention is going to be trust. Trust is incredibly important with well-being programs. I firmly believe that people need people, and our wellness program is aligned within our human resources and benefits department. But, that said, we couldn't deliver and scale this program without our Regents Empower technology platform. Technology is a crucial component to our program, but I'll also mention that trust really must be maintained when it comes to privacy. And but at the end of the day, it's really the human touch that we wrap around this technology that makes it trustworthy and successful.
Great. Thank you so much for sharing, Amy. And you're absolutely right. I mean, you need to innovate. You need to innovate to try new things, and clearly, Cambia is doing some pretty great things with your program. Recently, you were announced the healthiest employer in Oregon in your size category for the second year in a row. And what I actually think is equally as impressive is over the last 20 years, you guys have been ranked in the top 5 healthiest employers in Oregon each one of those years. And so my next question has to be, what do you attribute your success to for your program?
Mhm. I would say we really do have an inclusive and supportive culture from our leadership on down. Leaders are very in tune with our goals and objectives, and they understand that well-being is important for productivity and really the overall success of our company. It's who we are. Wellness is part of our DNA. Our culture embraces this with things like flexible work schedules. We have on-site gyms. We do webinars during lunch breaks and discounts on healthy items in our lunchrooms. We have treadmill walking workstations and more. So as a product of our innovation focus as a company, we definitely learn from our programs. Sometimes we'll put a program out there and it just doesn't stick, for a variety of reasons. But I look at engagement as an early indicator of a program's stickiness, and I gather feedback often. Our employees love to give us feedback, so we don't lack in that department. I One thing I would like to point out is getting your middle management on board. I have an example. We have a manager who talked with her team about the importance of doing stretch breaks, and she took it upon herself to experiment and cast that positive shadow for her team. And what she did was she would set a timer on her phone that would ding about every 15 or 20 minutes or so, and um, she would stand up and stretch. And after a while, her team, they started to join in, and they really felt they had permission, if you will, to do that. And then after that, other teams around them started doing the same thing. So it was really organic. There was no memo, no mandate, no lecture. And if you think about it, it kind of looked like people were doing the wave around the office. So that was kind of funny. And to me, that is really creating a culture of wellness and well-being.
What a great story. And middle management, it's
Yeah.
crucial for success of programming. And those individuals that you can see and you can hear regularly just walking around, and those are real influencers within the organization. So
Yeah.
what a great story to highlight what a healthy culture really looks and feels like. So thanks for sharing that with us.
Yeah.
Another question that I have for you, Amy, is as you look at, Cambia's had a program in place for at least 20 years now. And as you look back at evolution of that program and how you've managed it yourself, can you tell us a little bit about how your measurements of success have changed for your program over time?
Our measurements of success have really developed over time. When I first arrived at Cambia, it was crystal clear that, the company understood the importance of wellness and that it's the right thing to do. But as our programs evolved, got more sophisticated, and we started to spend more money and gained a little bit more traction around the incentives we were providing, we knew we needed to get a better understanding of the return on our investment. So we commissioned an ROI study, and thankfully, the ROI study showed a positive return on investment. And this study was a risk match, really rigorous endeavor that looked at absenteeism, healthcare spend, disability costs for participants versus non-participants in our program. And this was an excellent foundation for us that showed that these programs are working and really reaffirmed our focus that employees are our greatest asset, and we need to ensure that they're happy and healthy so they can live their best lives. And while most companies, they don't get to do an ROI study like we did, I feel there's obvious value in wellness programs. And today's job candidates are absolutely looking for a company that can demonstrate that they care about their employees' well-being. And when we interview candidates, one of the number one questions we get is around employee wellness programs. We are always asked, do you have an on-site gym? Do you offer flexible schedules? Do you have fitness reimbursements and more? So candidates seek out companies who take this seriously. And at Cambia, I feel our wellness program really does help us recruit and retain top talent.
That's great. And Amy, you hit on so many of the ROI and VOI points that Jeff made earlier on in this segment. And ROI is, oftentimes an important factor to look at when you're looking at the spend of your program and the investment that's being made more from the business side. But the culture pieces that you're talking about, and then the recruitment, the retention, all of those pieces falling more into the value on investment, which is how I like to describe it, the things you can feel, right? You can feel those things when you're in the building, when you're working with different employees, when you look at recruitment practices, and so that's really great, and what a journey Cambia has been on here. So thank you for sharing that with us.
Yeah, you bet.
And so, as we move from how you as an employer are evaluating the success of your program, can we talk a little bit about the true value of your program and what is your program delivering and giving to employees today?
I would say the value of our program is employees feel that we understand them. We meet them where they are. I know I mentioned that before, but not everyone is an athlete, and not everybody bikes to work. And then on the flip side of that, not everybody has high blood pressure, or not everybody needs to lose weight. So we offer many different programs to help people feel successful on their journey, whatever their journey might be. So one of our most popular programs is called Cambia Summer Games. It's a steps-based teams challenge. And what we've done with that is we have a tiered incentive structure. So we want people to strive for an outcome that they can achieve. It's important to us that people feel successful and that they can play too. Another program that we created was called Everybody Wellness. This program was born out of feedback that we received in our annual wellness culture survey around inclusion. And at Cambia, diversity is top of mind. And in the development of Everybody Wellness, we collaborated with our Pride employee resource group, and they worked with us to ensure that the health needs of the LGBTQ community were met, and through this effort, we learned to use appropriate language around people's identities, and we also provided resources for other diverse populations and potential health conditions there. It was really a great collaboration with the ERG. One of the comments we received about the program in the evaluation said that they thought the program should be a mandatory training course, and that made me smile. That made me smile. So the fact is, we don't all fit in the same mold, and that's okay. Again, we try really hard to meet employees where they are. Trust, empathy are essential, and continuing to innovate keeps us moving and trying new and different things.
Thank you, Amy, so much for sharing that. And I think that, as I listen to that response and think about working with other employers, what I pull from that is, when you're evaluating programs, it's not just looking at engagement numbers and some of the quantitative data that you get from programs, but it's also taking that extra time to capture the stories, the sentiments, right? The feedback from employees. And that can be more time consuming, but it pays just dividends when it comes to actually knowing how your program is working in the real world, in your actual company. So I think that's great. So thank you for sharing that with us. And you spoke at the very end about innovation and how innovation keeps your program going. And now I want to kind of just ask you, if we fast forward, you know, a couple of years, what's next? What's next for Cambia, Cambia's wellness program?
Well, what's next and change, that's really the word of the year. Our program will, of course, refresh, but I don't foresee changing something that isn't broken. So that said, we look at a number of data elements to get the big picture of our population's health. We look at claims data, including RX and biometric data from our annual screenings, as well as we'll continue to do culture surveys, to get that well-rounded view of what's going on in the population. One area that stands out to us for next year is a top focus area is going to be metabolic syndrome, which you likely know is a cluster of conditions like high blood pressure, increased blood sugar, and more. But taken together, really increase an individual's risk of heart disease, stroke, and type 2 diabetes. And we know through data that this is an area that we need to work on, and we intended to address this head on in 2020, and then COVID hit. So we needed to reshape the timing of our strategy, and eventually we're going to be adding a new vendor partner who can send test kits to employees' homes to capture those measurements, and then employees can have a virtual visit with a provider right from their own home. So that's going to be really important next year for us. And another factor we like about this approach is it includes a depression screening, which hits on another area of opportunity for our population, which is removing the stigma to getting mental health treatment. Mental health is huge right now. And what we've done at Cambia is we've recently implemented a more formal mindfulness and mental health approach. And we've partnered with a couple of different people. We partnered with eMindful Life and My Strength. And both of these have been very well received by our population. So we're excited for some of these initiatives and more that we'll continue to dive into over the next few years.
Sounds busy. Sounds like some great initiatives ahead of you. And you brought up the word of the year, COVID-19 pandemic. And I would be remiss if I didn't take a second, Amy, to ask you, How have you and Cambia managed through this year with COVID-19 and shutdowns? I understand that your population moved almost predominantly remote this year. And so, can you tell us a little bit about the challenges that you faced and how you overcame them?
Well, this year has presented challenges for all of us. But with challenges come some pretty neat opportunities too. One of the new things we implemented was a wellness webinar series, and we hosted a webinar almost every day of the week, Monday through Friday. Sometimes they were only 10 or 15 minutes on a topic from, let's say, mindfulness to reducing stress or maybe tension in your neck to nutrition. We're lucky that we have a resident chef in Hillary Lauren to provide some nutrition and education around healthy cooking and so on. We also provided some longer targeted series, and one of them was about yoga, which I was particularly excited about. Um, Another frequent topic, since you mentioned, Megan, we are 99% of our population is working from home, which is a lot of people working from home. So we needed to focus on ergonomics and proper setup of an employee's office at home. So we've really learned a lot this year, and some of the new activities will continue. Even after our employees head back into the office, things things change, and that isn't always bad. A lot stays the same too, but we'll just continue to innovate and practice resiliency.
That's awesome. And so many great words of wisdom there for all of us to heed this year. And so, my final question for you today, Amy, is as we've got an audience of HR professionals, financial professionals on the line, if you were to impart one piece of advice to our guests on our webinar today when it comes to measurement of their program success and thinking about ROI, VOI for well-being programs, what advice would you provide?
Hmm. Well, choosing one is hard. I would say do what you can to maintain the humanity and the empathy within your programming. Spend the time to really understand your population, not just through the claims data and the risk factors, but what matters to them. Design programs that help them be and feel successful, and make them feel like they're part of something bigger. I feel that this approach will help them, and it will increase your engagement in all of your efforts as well.
Thank you, Amy, so much for sharing that piece of advice with us. And we are so fortunate and thankful to have had both you representing Cambia Health Solutions and Cassie from Columbia Sportswear sharing your company stories in our VOI and action section of our webinar today. So thank you so much.
So thank you, Megan and Cassie and Amy. This was really good information. And this concludes the end of our webinar. If you'd like to learn more, remember there's a form that's about to pop up at this end of this webinar. And you can also contact us directly here with this email address and phone number. And we hope to see you again. And if you're curious, we have one last slide which describes in a little bit more detail what our 3 different divisions do. We will send you the slides and the video at the conclusion of this webinar as well. Thank you again for attending.